Hi, class. I'm going to take you through strategic management for healthcare organizations. Um, Essentially, this will cover strategic thinking portion of the course. Healthcare is probably one of the more complex systems because you have uh, usually one consumer but multiple payers. So, for example, um, I'm enrolled in a healthcare plan, but my employer pays for it. Um, uh, and or the state pays for it or the federal government pays for it. There's really not a lot of examples of industries where that occurs. It's happened, the trend, as you know, over the last 10 years is um, your employer pays for it and now you're paying a bigger part of it. So actually, we have seen significant slowing of healthcare, rising costs, largely as a result of certain cost measures put in place by payers to purchasers, which are um, uh, for purchasers, which are your employer or the government, um, by restricting or somehow creating a way to keep costs down on the provider side. But we're also seeing the consumer side of things where now that we're paying a larger portion of our own healthcare services, we're being more prudent as long as we have the information we need to make better decisions. And so we're starting to see that evolve, which is brand new for the healthcare industry, considering how expensive and how large healthcare consumes our economy. It's 17% of GDP right now. And for the largest country in the world, 17% of GDP is a big, big chunk. Um, and the fact that the consumer, patient, really didn't have access, let alone easy access, to make informed decisions up until probably 5 years ago is remarkable to me, if not borderline criminal. So anyhow, these things are happening in the healthcare market. So let me take you through this. This will apply towards, obviously works really well with organizational change, because when you have to make organizational change, you have to have a process to do it, a framework um, that focuses on building consensus and formulating a vision strategy relative to your product uh, value and your market competitiveness, as well as your consumers. So we'll get going. So, for example, major changes for 2000 to today, and you can think of a few, but these changes are typically what influences businesses and organizations, the external changes. So I put a few here. Obviously, 9/11, Great Recession, first African American president, Arab Spring, populism, which we're seeing now here in the West, and our first reality TV star president. Healthcare, the end of the HMO area ended in around 2000. Disease management became more popular than managing an episode of care. Pay for performance, really attempt to control costs by paying providers for how well they performed in terms of quality, but it was largely how much they could save. The HITECH Act, which is, uh, you may have seen at your physician office, where your providers are all on laptops now, trying to create a world of shared data. Gene therapy is becoming much more, we'll see that to be much more popular and effective. Antibiotic resistance is a major issue in our country and in the West. And Obamacare, and probably the reform of Obamacare after that. Possible future changes. Oops, sorry about that. Um, Rapid climate change. Oops. Food and resource distribution, which will cause more, especially around the coastal lines. Cure for certain diseases, I think we'll see, but we'll also see more diseases come about. Uh, healthcare, the healthcare re-reform era, which will be under this next administration. Healthcare, I suspect, will become 30% of GDP before 2030, and essentially that will affect every single purchasing decision we make. That'll pretty much put your healthcare budget probably right after your mortgage. And advances in artificial organs, for example. You can think of others, I'm sure. So, what is strategic management? Strategic management is an externally orientated philosophy of leading and managing an organization using strategic thinking and periodic strategic planning in conjunction with strategic momentum. So, those are the three elements. Strategic management is the term commonly used to describe all three activities. The value of strategic management: a system to identify and understand environmental changes that enable organizations to be successful in dynamic environments. In other words, as the environments begin to change, if we're aware of the change, hopefully we can create a culture as leaders to adapt to that change. I'm in the middle of a sort of a culture change movement right now as Connecticut nursing homes. Connecticut really works on reducing the number of beds in the state, and so there's less referrals to nursing homes, not because of the state, just because of current trends to home care, but trying to get an organization that the average longevity of its employees over 15 years, and they are unionized employees, so they're used to getting whatever they want, regardless of the external environment. But it's been clear that if we don't adapt and change, in this case, reduce costs, and perform better in terms of quality outcomes, there won't be any jobs. And we're making progress because they know enough of their colleagues who are out of work at this point. So it could be a slog. Enable healthcare organizations to cope with whitewater change or hypercompetition. And the evolution of, let me see. So whitewater change is considered hypercompetition. We see in most markets today, especially like the tech market. But now it's truly, it's at the healthcare market for the last, I'd say, 10 years, but Connecticut's market has been very closed due to state policy, which controls who comes into the market, which is, one would argue, unfair. But that market has been open to for-profits now because of the impending loss of healthcare services in Connecticut, because our hospitals can't compete. So now we have 3 major for-profit healthcare chains in Connecticut that own St. Francis, Rockville, Manchester, and St. Mary's Hospital, and as well as another group, I think, down in Fairfield County. Evolution of strategic management originated from the military. Healthcare, in this case, healthcare planning, prior to the 1970s, was mostly federal, state, and local health policy planning. Traditionally considered long-range business planning, relatively static. So you would do a plan for 5 years. It was a great way to kind of get your board on the same page, talk about capital planning, expanding, especially in the environments that were regulated, like the airlines, healthcare, energy, things like that, where change was slow, and basically you just had to follow the regulations that were promulgated by government. And that's all has changed everywhere. Evolved into a system to identify and understand environmental changes that enable organizations to be successful in dynamic and shifting environments. Fortunately, the tenets of strategic management can be applied daily, especially with the ability for us to get big data and decipher it within our markets and determine what we need to do. So I do strategic planning, which is the written form of strategic thinking, yearly now, and it's only good for usually a year at a time. And that's considering I'm in the healthcare market, which is regulated, which requires certain laws to be passed, which can take time. However, a large chunk of it now is unregulated and consumer driven. So it's even more important that even in an environment that's structured like or regulated like healthcare or energy, it's all has changed. Healthcare industry and strategic management. Recent years, the expansion of the healthcare system, fragmentation of markets, the growth of investor-owned hospital companies, and emphasis on cost containment have induced individual healthcare organizations to adopt strategic management. Okay. And now here's an interesting example for sort of a relatively regulated industry. Back in the day, you would just 2010. Here's when HMOs were born. Now you guys might remember HMOs. We really didn't dip our toe in that water until 74. So concept came up in 2010. Really was federally promoted in 1974, and frankly, when I started my career, that's when HMOs became very important, and that was the essential beginning of the managed care. Right here in 1993, beginning of the managed care movement. Unfortunately, it didn't work, and the only reason it didn't work, in my opinion, is it was managed finance, not managed care, and largely because we could see the dollars going out the door faster than we can get the data showing clinical outcomes, hence the big move to electronic medical record. In an environment where you get paid on outcomes related to days in hospitals or costs associated to utilization, you need to have the utilization, the cause for utilization real time or it won't work. That's been the major problem. Okay. So as you can see here, all the changes in a very structured and then sort of 1990, I like the end of HMOs starts to begin here, and I remember in 1998 we hit a crescendo. PPOs were pretty much the same as HMOs, just gave you more flexibility, and then things really started to fade from there because purchasers wanted access. Hospitals began to strategically develop strategies against the payers to not negotiate. So if I don't negotiate their rate here in Hartford and St. Francis doesn't, guess what? The HMO has no other choice. So they have to concede and give us the cost we need to cover our services. So that's essentially how that ended. Okay, dimensions of strategic management, ways in which to think about strategic management process in organizations. So that's critical. It's all about critical thinking, and that's one reason why you're in college and you get paid the big bucks. It's your ability to apply not only to be an effective critical thinker, you have to have the knowledge base to apply critical thinking for the outcomes that are necessary. So you may be born a critical thinker, for example, a great chess player, but if you don't put any effort into collecting data or educating yourself in a particular discipline, you're likely going to fail. So that's why it's important to learn as much as you can about the environment you're in or the market you're in and apply these techniques. So analytical or rational approaches Strategic management relies on the development of logical sequences of steps or process, linear things. So I think of it more as equivalent to a map. This was sort of like how strategic planning was done um, back in the 70s, early 80s with healthcare. We would just wait to see what new state or federal regulation came out and follow that string and plan for it. And then anything outside of that loop that wasn't regulated, we'd see if there was a way to take advantage of some opportunities. You might remember, it still goes on, diversification strategies of hospitals and healthcare organizations. So they got into building medical office buildings, house physicians. It was a form of revenue and real estate development, health clubs, a variety of other sort of non-related business opportunities. And linear planning really works well, like I said, as it says here, in a stable and known environment. Emerging models rely on intuitive thinking, leadership, and learning, lateral thinking. And this is why the ability to collect information constantly and review it, prioritize it, categorize it, and prioritize it is important because things are changing so quickly. So equivalent to a compass, effective in uncertain and dynamic environments. And that's where we are in healthcare, but that's where we are in most markets that you may be working in. If you're in the insurance market, you're seeing that now. I just heard an interview by the Aetna CEO yesterday, and they had quite a few contingency plans for the presidential election and congressional elections. They did not have one that assumed Donald Trump would win and that Congress would be controlled by Republicans. The interesting thing is, Aetna has committed itself to disease management, not just financial management. And so for a company like Aetna, Obamacare is something that they've baked into their strategic planning model. And now that may be all at threat. So that's a significant change of uncertainty. And so they, as he mentioned, they got in the next, right after the election and started writing scenarios. Neither approach is better than the other. And here's the different types of schools of thought, basic process, and then a brief description. All of them are really based on the premise that you know your market and how you want to apply strategic thinking the best for your particular organization. Why we need a strategic model, why we need a strategic management model. A model is an organizing framework to conceptualize a complex process. Without it, we become overwhelmed by information. Models reveal relationships and underlying logic of phenomenon, and models draw upon system thinking, illustrating interrelationships. It's another critical component you probably all experienced in larger organizations where we operate in silos. So there's a strategic, sometimes it's not considered strategic, but a tactical move in a particular market, typical department. And it doesn't formally include the impact on other departments. One, because they haven't considered it or don't realize it. So I can give you an example. In the organization I'm working to turn around now, we've made some tactical decisions to open what will be one of the first what's called delirium units in the country. And for short-term Medicare residents, actually they're a little longer than short-term, but one key consideration is the regulatory implications of a program like that, which is within the scope of the license of the skilled nursing home and of the staff. But for example, this particular segment or patient population will be what's called hypoactive, which means they're more of a vegetative state that we have to get them out of and into back to normal. And so the unit that I'm looking to open, one of the things we realized because we plan as a team is that we don't have a dining room. We have a dining room, but no dining room furniture, and that's required by the state. Personally, I don't expect many of these folks to be eating in a dining room. Most short-term patients don't eat in dining rooms. They like to eat in their rooms for whatever reason. But the program can get shut down when state inspection comes through, which we have annually, surveyor certification, and there isn't dining room tables and chairs. So for a programmer trying to develop what's called a proof of concept, that there's a market for it and that there's revenue and it could work, I'm looking at another $8,000 investment in furniture to set up a dining room that probably won't be needed. So one example about how we work together so we don't miss these things. So how can we be creative in maybe not laying out that kind of money? I'd rather use that for a bladder scanner, where if this model doesn't work, I can use it with my other residents. But many times we make decisions and the other departments aren't aware of them until it starts to impact them, and it creates a real issue. Models drawn upon system thinking. That's why we want to make sure it's important and can clearly show the necessary steps in a process and become a means to communicate those steps. That's the other thing. You develop the plan with everyone and all the key players involved. And then those who may not be directly involved, it's important that you come up with a process of communication, because at some point they may become, it may impact them. We've seen this in billing in healthcare many times with these multiple payers. Think about how many payers you have in healthcare. Now, most businesses have a variety of payers, and they're consumers, so we can either charge them cash, point of sale system using a debit or credit card, and even take a check. In healthcare, you can have all that, which is maybe 10% of your cash flow. The rest, I'd say 70 to 80%, is third-party reimbursement. So in other words, I got to collect your copay at the door. That's one process. And the next process is I have to bill your insurer, or Medicare or Medicaid, and they all have different requirements. So we have to have all these billing systems in place to be able to submit these claims, because if the claims aren't clean, you don't get paid. So it's a complex process. So when you get into things like a contract where you have a 20% withhold, which is where the managed care company will withhold 20% of the fee, and you can get that back as all or a percentage based on performance measures at the end of the period. That's something for that particular contract and that particular payer that you have to take into account when billing. So billing doesn't get all these details, or the system can't handle that or process that. That can become a major barrier and become a real strategic problem. And then you have to figure out, is there a cost benefit to resolving it or not doing that particular contracting model. So anyhow, the models combine analytic and emergent views. Strategic management has three elements: strategic thinking, planning, and momentum. The momentum part is usually the part that gets lost in the day-to-day because of all the other fires we have to put out. The activities are interdependent, and activities in one element affects and are affected by the others. So I like this map of strategic thinking. It's by William Porter, who's a professor emeritus at Harvard, and probably one of the leading thinkers of strategic, of business management and strategic planning. And in external model, so strategic thinking looks at external orientation, where we are vis-a-vis our market, both local and broadly, analyzing the data that's coming in, what's going on in the market, what's going on in our sector, questions and assumptions, and generating new ideas. So, for example, one of the challenges I got into with the organization I'm with now is, they're losing over $1 million a year. The operator is very reputable and has resources to put into the organization, but he just doesn't know this market, which is Connecticut and Hartford, New Haven market, and I do. So through hiring me, I have relationships with key players at other hospitals. And then I also understand the impact of the Affordable Care Act, which doesn't directly impact long-term care. It's the indirect impact on our upstream payers, such as hospitals, who are put at risk. So how do we relate to them? And so that's where I come in. So for example, in a nursing home, 20%, I'd say 70% of your population or more is what's called Medicaid, the indigent long-term care. And in Connecticut, the cost of providing care here versus the Medicaid reimbursement, the average nursing home probably loses on the average of $50 a day. So if you have 70 residents times $365, multiply that times $50 a day, and that number is essentially what you start out with when you start to plan the gap that you have to fill in your operating budget. Now, Medicare is the best payer for long-term care, but it's an insurance product, so it can only be applied to those who are eligible for Medicare, which are in recovery. And Medicare, if you're efficient, can give you a margin of $100 a day over costs. And so a 20% Medicare mix can basically offset a 70% Medicaid mix. And then there's commercial, and that's insurance. And for our particular industry, commercial is usually not a great payer because they don't feel they have to pay for post-acute care, or it's hard to manage. It's for health insurance companies, our primary goal is to recruit physicians and hospitals because that's what employers know their employees want. Employees don't think about where they're going to recover. They don't think about home care until they need it. They just know, I need my doctor for preventative care or a cold or a flu, and the hospital I would go to for an emergency. Healthcare insurance companies now, under the Affordable Care Act, as well as hospitals, are realizing what we pay $4,000 a day stay in a hospital can be done at a SNF for about $400 a day. So there's a big potential cost savings. So bottom line is, for long-term care, the rates aren't as good for commercial as it is for Medicare. Now, if we flip that over and we look at doctors and hospitals, Medicaid's the worst payer, just like for long-term care. Medicare is the second worst payer, not second best, and that's roughly 60% of their book of business. And commercial insurance companies are their best book of business. So when the Affordable Care Act raised the Medicaid reimbursement rate to be the same as the Medicare reimbursement rate, especially for providers, that was considered a solution to solve the supply and demand issue of providers to serve the indigent population, because the Affordable Care Act's purpose was to really get more people covered to reduce emergency room costs, which are the most expensive. The reality was the physicians weren't thrilled to now get Medicare reimbursement for Medicaid. It had really no positive impact. studies argue. The way I look at it is I think it did, because you can use physician extenders like PAs and APRNs. This is a strategic thinking process, who can deliver services below cost of what Medicare pays. So it makes it cost effective. And so, in other words, the model is working, although many argue that it really didn't have an impact, but it did. You're seeing a lot more PAs and APRNs for two reasons. One, there isn't enough PCPs, and there won't be. Secondly, now a practice can take on more volume. Medicare patients being seen once by a PCP, then followed up by an APRN. The economics work. So, and the only way we're going to address the supply side of the physician equation to support, I think 21 million people now insured that weren't insured 5 years ago, is through physician extenders, PCPs, and APRNs. So anyhow, so that's a model that works. So anyhow, so we consider all this stuff here. We put it through our strategic planning. In here, external analysis basically looks at the environment around us. The internal analysis matches up what's going on in the environment that's going to impact us. And internally, do we have the capacity to meet the challenge or take advantage of the opportunity? So, for example, in developing my delirium unit, I looked in the external environment and found that every nursing home that is in an accountable care organization's preferred provider network, they're already invested and sort of locked in with the common diseases that would get stepped down appropriately to a skilled nursing home, like congestive heart failure, COPD, some other cardiovascular, neurological, those sort of things. So the market's saturated. To break into a market that's sort of matured like that would take more time and influence, which is really tough in Connecticut. So the concept of doing delirium through my strategic thinking process and working with geriatricians and researching big issues hospitals have that many of us aren't aware of, it's a major, major problem. And one part of the strategic thinking process is what's the size of the problem? What part of the problem can be addressed by my organization under the scope of my license and capabilities? And from there, what would be the investment, resources, and will there be a return on investment? And lastly, how do I position myself to essentially make sure I educate my referral sources and get those referrals? And then, probably most importantly, is what's my ability to evaluate my strategy outcomes and create a feedback loop to prove value added to my customers, which are the hospitals. So, long story short, as I did my external analysis, sure, people with delirium do get discharged to SNFs, but there is no, it's called encephalophagy, there is no particular care pathway or program. So that's an issue in itself. Then when I looked at the financial implications of delirium-related comorbidities, in other words, somebody comes in for cardiac procedure, the procedure is successful, they come out of the anesthesia and they're delirious, either hyperactive, bouncing off the walls, you have to restrain them, or hypoactive, where they're sort of in a vegetative state. Many times it's been confused as dementia. And the hospital has a major issue on their hand. So, for example, a procedure, say a hip revision, is most hospitals can generate a really healthy margin off a hip revision. And they know their length of stay might be an average of, depending on the age and other factors, but let's say an average length of stay is 4 days maximum, and then they can get them out. And X number of dollars they'll make off that procedure based on a 4-day length of stay. Somebody comes out of a hip revision and has delirium, you're looking on average 3 times the length of stay. And so now a service line that you've created that's profitable, with 8 out of 10 patients or 7 out of 10 patients, 3 of those that end up with delirium basically can wipe out your margin for that particular service line. Plus the mortality rate and the quality issues are huge. There was one particular intervention that was put in place at Hartford Hospital about 2 years ago by a friend of mine, and the result of his work which was primarily on the prevention and intervention side, reduced the average length of stay for patients with a comorbidity of delirium by just 2 days. So let's say if you have delirium, your average length of stay is, 20, maybe say 16 days. Shaving off 2 days for Harvard Healthcare resulted in a $35 million savings. So understanding that, then you begin to realize, okay, well, where are these patients going? How can we shave off another day? And that's how we come up with these ideas, and then we start to unpack them, and they become different types of strategies, and then how do we implement them, and the action of constantly evaluating and reinitiating. This is the part that usually falls away. So a way of thinking or mindset underlying the strategic management philosophy. Strategic thinking occurs at an individual level. Strategic thinking is required to manage the implementation of a strategic plan. Everyone should be encouraged to think strategically and how to reinvent what they do in light of the changing environment. So true. The more people that know what's going on and how it affects them and the organization, the more likely you'll get some innovative ideas. Requires a mindset, way of thinking. So thinking as a leader, acknowledging the reality of change. That's probably the most difficult thing. And question current assumptions and activities. So why are we doing what we're doing, and how do we do it differently? Where I'm at right now had 3 different owners. Each of them were there. One was 12 years and one was 7 years. And the mindset is somewhere between those 2 ownerships, and those ownerships didn't work out, so it has to change. Build on an understanding of systems and envision possible future. This generates new ideas. And consider fitting the organization to the external environment. So in other words, you might have a great idea. That's awesome. But if the environment, if the market isn't interested in that idea, then it's your hobby. If there is an interest, then you have a business. So here's how it looks in terms of a strategy to vision. Vision, hope of the organization of the future. So vision is what we want to look like if we meet our mission. We talk about whitewater changing, political. Is the periodic process of creating strategy or a plan using strategic thinking. And this is where we write it down. It is usually a periodic group activity results in a formal written document. Really important. When I started my career, I started as a strategic analyst, and I would do all the analytical work, prepare reports, and then I'd meet with my board, which was a diverse group of providers, hospitals, all not-for-profit hospitals, 2 home care agency, 2 nursing homes, and physicians. And so, this was back in the 90s, and they really didn't know how each other interrelated. They just referred when they had to, because what I learned then is that the reimbursement system didn't create any incentive for them to work together. It created silos. So when this my strategic alliance was formed, there was a big process of learning what each other can do in their value proposition. And one way to do this was through the research that I would find and then share with the group, and the group would then process it, and then through that we'd all learn a little bit more about what our capabilities are and our likelihood to work together successfully in managing care. And it results in a plan and provides a structural process for reaching consensus and document strategic thinking. It's another huge thing I've run into early on in my career. Best ideas, see the future, but if you don't build consensus, even though you're right, it won't happen. And then things blow up, and it's just a very frustrating process. Having periodic initiatives, considering discussions and documentation of all assumptions. So whenever you're making change, document it. Provide a sequential step-by-step process for creating a strategy. So who should be involved, how we're going to do it. It involves periodic group strategic thinking sessions, which are called brainstorming. Requires data information, but builds consensus and judgment. I think that's really the important part I was trying to get to. Establishes an organizational focus, because if you're building consensus, you're building a focus. So for example, in a supportive department like in healthcare, like dining services, we initiated person-centered care, which is changing the model of a nursing home to a home-based model where services and supports were really centered around the resident's preferences as a human being in their home versus the hospital model that we adopted back in the 70s, which was task-based. If you've ever been to the hospital, you know they just come in and do whatever they got to do any time of the night. Person-centered care changes that. So in nursing home culture change, we look at empowering the primary caregiver, which is actually the CNA, to really have a lot of involvement in care decisions, care planning, because they know the residents the best, and to have them foster the relationship between their residents and families. So when there is change in condition, they'll be the first to know, and the interventions can happen quickly. But also quality of life is really important. So how do we make sure those residents' needs are met based on who the resident is? So that's the primary objective, but a supportive strategy becomes, okay, so if a resident wants UC breakfast at 10 in the morning, not at 8 o'clock, like when we serve it, how do we meet that need? And that's where, for example, dining services needs to be in the room. It's not a direct, it's an indirect strategy or a process plan that has to be addressed. So how do we get dining services into it before we implement the plan and realize we left part of the organization out? And then what eventually ends up happening is dining services under person-centered care has a whole unique process change. So in terms of the type of meals they serve and when they serve them. So it's all about consensus building. And this will result in adoption of the organization to the shifting environment. So we look at our situational analysis, the external environmental analysis, what the organization should do. Internal environmental analysis looks at inside what the organization can do. So what's the gap between what we need to do and what we should do. And strategy formulation is planning and implementation, and basically filling the gap. If we have an internal weakness, how do we resolve it? If we have an external strength, how do we exploit it? So analyzing and understanding the situation. So we have our external environments, our vision and goals, what the organization wants to do, and then internal environment, what the organization can do. This is the most important thing. What the organization should do is based on who's going to pay for it. So integration of what the organization should do, wants to do, and can do to provide a picture of the solution. This is the basic for strategy formulation. So your vision and goals really should come from your external environment, because that changes. So intended strategies, they become unrealized. Deliberate strategies, re-emerging strategies, that's the momentum component. In the large organizations, this is how strategic thinking starts at the corporate level. So you have your strategic thinking, momentum, planning, and then it's got to get down to divisional, and then it's got to get down to organizational. And this is usually the gap where we many times we lose it. So it's important that large organizations have facilitators that are involved in kind of getting involved in driving these initiatives all the way down to the functional level. Okay, so that is the basis of how to drive organizational culture change based on your market and market influence, and also the structure and design of your organization, how that may need to change to meet these adapt to these emerging changes in the market. Hope that was helpful.